Imagine finding yourself or a loved one in emergency room, facing a health challenge that could dramatically change your life forever. How could you ease that situation? We have Dr. Carol Roberts, author of Good Medicine, A Return to Common Sense, who's integrated her MD status from Albert Einstein College of Medicine, where she practiced in emergency room and operating room, who can give us some advice on how we can deal with that situation. Carol, can you give some advice?
Well, having been an emergency room practitioner for 6 to 7 years, I can tell you that the patients generally are frightened. They have a situation that they don't know how to control. All of a sudden, they've been left with, without resources and without information. It can be frustrating, it can be terrifying. So the first thing I would say is remember who you are. Center yourself with whatever techniques you have, deep breathing, meditation. If you're lucky, you've been practicing those skills. If not, it's not a bad time to start. You're going to have a lot of waiting time where you're going to wonder what's going on. If you need to, stop some staff and ask them. Don't be afraid to ask questions. Stand up for yourself. Don't get pushed around by a staff who may have very good reasons for doing things, but if you don't understand those reasons, you cannot make an informed decision. So the best thing is, remember yourself. Remember, or if you're speaking for a loved one, ask lots of questions, be polite, but be persistent. Make sure that you will know how to have access to that information later, so you can take it to your own doctor. If you are required to be admitted to the hospital, find someone who can be your advocate. Call your family practice doctor or a doctor that you may be familiar with as soon as possible and get someone to kind of help you navigate. Ultimately, the best thing is not to go to the emergency room in the first place, but they're there for a very good reason. They excel at saving lives, at stabilizing very uncomfortable situations, and that's what you deserve. But you need to know what's going on.
Absolutely. And for many of us, I think that this has been very helpful. Thank you, Dr. Roberts, because we know we don't plan to end up in emergency. But I think finding these points of help, and you can go to www.carolrobertsmd.com. Get her book, Good Medicine, A Return to Common Sense, that may keep you away from that emergency room. And if you do get there, she's here to support you.